Depression is a mood disorder that causes a persistent feeling of sadness and loss of interest in things and activities you once enjoyed. It can also cause difficulty with thinking, memory, eating, and sleeping. Depression is different than sadness. It persists practically every day for at least 2 weeks and involves other symptoms than sadness alone. Without treatment, depression can get worse and last longer. In severe cases, it can lead to self-harm or death by suicide. The American Psychiatric Association's Diagnostic Statistical Manual of Mental Disorders, 5th edition, DSM-5, classifies depressive disorders as the following. Clinical depression, major depressive disorder. In this you felt sad, low or worthless most days for at least 2 weeks while also having other symptoms such as sleep problems, loss of interest in activities, or change in appetite. Disruptive mood dysregulation disorder, DMDD. DMDD causes chronic, intense irritability and frequent anger outbursts in children. Symptoms usually begin by the age of 10. Persistent depressive disorder, PDD. Persistent depressive disorder is mild or moderate depression that lasts for at least 2 years. The symptoms are less severe. Premenstrual dysphoric disorder, PMDD. With PMDD, you have premenstrual syndrome, PMS, symptoms along with mood symptoms, such as extreme irritability, anxiety or depression. These symptoms improve within a few days after your period starts, but they can be severe. Seasonal affective disorder, seasonal depression. This is a form of major depressive disorder that typically arises during the fall and winter and goes away during the spring and summer. Atypical depression. Symptoms of this condition, also known as major depressive disorder with atypical features, vary slightly from typical depression. Prenatal depression and postpartum depression. Prenatal depression is depression that happens during pregnancy. Postpartum depression is depression that develops within 4 weeks of delivering a baby. The DSM refers to these as major depressive dis. The symptoms of depression can vary slightly depending on the type and can range from mild to severe. In general, symptoms include feeling very sad, hopeless or worried. Children and adolescents with depression may be irritable rather than sad. Not enjoying things that used to bring joy. Being easily irritated or frustrated. Eating too much or too little, which may result in weight gain or weight loss. Trouble sleeping, insomnia, or sleeping too much, hypersomnia. Having low energy or fatigue. Having a difficult time concentrating, making decisions or remembering things. Experiencing physical issues like headache, stomachache or sexual dysfunction. Having thoughts of self-harm or suicide. Brain chemistry, an imbalance of neurotransmitters, including serotonin and dopamine, contributes to the development of depression. Genetics, if you have a first-degree relative, biological parent or sibling, with depression, you're about 3 times as likely to develop the condition as the general population. Stressful life events, difficult experiences, such as the death of a loved one, trauma, divorce, isolation and lack of support, can trigger depression. Medical conditions, chronic pain and chronic conditions like diabetes can lead to depression. Medication, some medications can cause depression as a side effect. Substance use, including alcohol, can also cause depression or make it worse. Depression is a condition that affects millions of people every year. The good news is that depression is treatable. If you have symptoms of depression, talk to your healthcare provider. The sooner you get help, the sooner you can feel better.